I am Elizabeth Goetz, and this is an ethics decision-making video. We'll be focusing on a conflict between a patient's surrogate decision-maker and their healthcare provider. Advanced directives provide written legal instructions regarding preferences for medical care in the event that a patient is unable to make decisions for themselves. Now, in the event that a patient cannot make medical decisions for themselves, the Illinois Healthcare Surrogate Act allows family members or friends to make medical decisions on their behalf. If no relevant power of attorney is in effect, decision-making is appointed to legal guardians, spouses, adult children, parents, siblings, adult grandchildren, close friends, or a court-appointed guardian, in that order. The rising use of advanced directives have made surrogate decision-making both easier and harder. In many cases, these directives help guide decision-making for patients who have lost decision-making capacity. In some cases, however, directives may conflict with what the physician or surrogate view as what's in the patient's best interest. And these conflicts can place substantial emotional and moral burdens on physicians and surrogates, and there's little practical guidance on how to address them. In the case study being presented, a patient's daughter will be burdened with such a conflict, and the patient's primary care nurse practitioner, morally distressed by her decision, must navigate this delicate ethical dilemma. To start, let's meet our patient, Debbie. 6 years ago, Debbie presented to her primary care nurse practitioner, Pete, with complaints of a chronic headache, cough, and fatigue. She was later found to have metastatic lung cancer that had spread to her brain. Her prognosis was poor. She has undergone a craniotomy, gamma knife radiosurgery, and 3 rounds of radiation. Unfortunately, her brain tumor has grown after each surgery and continues to grow despite radiation. Per her oncologist, Debbie cannot undergo any more surgeries or radiation, and she has elected not to pursue chemotherapy. Over the past few years, Debbie has become intermittently confused, depressed, forgetful, paranoid, housebound, and sometimes even hostile. She takes multiple medications, including steroids and methadone. Her steroids keep her up all night and leave her feeling bloated and irritable, and despite being in constant pain, she hates taking pain medications, which leave her feeling doped up and constipated. In June, Debbie was hospitalized for a small bowel obstruction. She was not able to eat or drink, an NG tube was placed for decompression, she received IV fluid hydration. Her hospitalization was complicated by severe delirium. Once the delirium had resolved, she decided that she had had enough. She discussed her goals of care with her primary care nurse practitioner, Pete, and was adamant about spending her remaining time at home. During this hospitalization, Pete signed Debbie's post indicating not to attempt resuscitation and to provide comfort measures only. Debbie's only daughter, Becky, signed as her witness. After this hospitalization, Debbie realized she needed a little more support at home. Unfortunately, her husband had just died 6 months ago, so Debbie moved in with her only daughter, Becky. Now, early this morning, Debbie was more lethargic than usual. She was having trouble moving her right arm and leg, and as a result, she fell and hit her head on the kitchen counter. Becky witnessed the fall and called 911. In the emergency department, Debbie is diagnosed with an epidural hematoma. Her tumor was found to have grown since her last scan and is now causing obstructive hydrocephalus, which led to her fall. The ED provider has consulted neurosurgery, who recommend placement of an EVD to drain CSF and another drain to aspirate the hematoma. Becky is faced with a dilemma. She feels that her mom would not want to be aggressively treated, but at the same time she isn't prepared to lose her mother. Ultimately, Becky signed consent for the drains and requested full code status. Becky seems to have been influenced by the self-serving bias. She unconsciously made a decision that served herself and not necessarily her mother. Self-serving bias often blinds us to ways in which we are prejudiced in favor of ourselves. It can cause even the most well-intentioned person to completely overlook their own bad actions. Pete, alerted to his patient's admission, is morally distressed when he hears that Becky has made her mother a full code and has signed consent for invasive neurosurgical procedures. Moral distress is the psychologic, emotional, and physiologic suffering endured by healthcare providers when they must act in ways inconsistent with their deeply held ethical values, principles, or commitments. Pete believes he knows what the most ethical course of action would be in this case, hospice, but Debbie's daughter has instead elected for aggressive care. Her decision conflicts with some of Pete's deeply held ethical values. As a provider, Pete values patient autonomy, or the patient's right to self-governance. He values non-maleficence, which is the belief that one's actions should do no harm. He sees value in beneficence, or the obligation to promote the welfare of others. He also values integrity, which is the practice of being honest and exhibiting a consistent and uncompromising adherence to strong moral and ethical principles. Having recently signed Debbie's post, Pete believes providing aggressive treatment would violate her autonomy. His professional opinion is that this aggressive care would not meaningfully increase Debbie's life expectancy. He believes it will only serve to prolong her suffering and cause additional pain. James Rest developed a framework for the development of ethical skills in nursing practice. This 4-step framework starts with recognition of an ethical situation and ends with the implementation of a justifiable action. Let's see how Pete progresses through these steps. Pete has already exhibited moral sensitivity, which is the ability to recognize an ethical dilemma exists. An ethical dilemma is conflict over values. He recognized that Becky's decision conflicted with his values and beliefs of how to best care for Debbie. The second step of REST framework is moral judgment or ethical decision-making. This is a deliberative process reflecting knowledge of ethical principles, theories, and professional codes. To assist him in the decision-making process, Pete refers to his belief pocket card that he received when working on his D&P at Northern Illinois University. This card will walk him through the ethical decision-making process. First, Pete will determine the facts and state the problem. Debbie has been clear about her goals of care and even filled out a post indicating that she would want to receive comfort measures only. After this morning's fall, Becky rescinded her mother's DNR and has signed consent for invasive procedures. Unless Debbie's feelings have changed since their last encounter, Becky's decision threatens Debbie's autonomy. These invasive procedures will not prolong Debbie's life and will likely result in increased pain and prolonged suffering. Next, Pete considers the stakeholders. His decision will affect himself, Debbie, Becky, and all other providers involved in Debbie's care, including the neurosurgical team, nursing staff, and case management. The third step in the belief model is identifying relevant factors. Becky is Debbie's legal surrogate and is therefore in her right to determine goals of care. However, according to the Illinois Healthcare Surrogate Act, surrogates are to make decisions that conform as closely as possible with what the patient would have wanted, taking into account the patient's personal, philosophical, religious, and moral beliefs and ethical values relative to the purpose of life, sickness, medical procedures, suffering, and death. Becky just recently lost her father, and she may be feeling overwhelmed with the thought of losing another parent so soon. Now, Pete has a fiduciary responsibility to his patient, and Provision 3 of the Nursing Code of Ethics indicates that he has the professional duty to protect the rights, health, and safety of his patient, specifically her right to autonomy. Next, Pete will develop a list of potential solutions to his problem. He could provide aggressive care as directed by Becky, Debbie's legal surrogate decision-maker. He could honor Debbie's post and refuse to provide aggressive care despite Becky's wishes. He could talk to Becky about his concerns objectively and candidly, or he could request that a different attending care for Debbie. He will use the following tests to evaluate the aforementioned options. He will ask himself, is this option legal? Would I want my choice to be published in the newspaper? He will ask himself if each option does less harm than the alternatives. He will consider what his colleagues would say if he described the situation and suggested this option as a solution. Most importantly, he would consider what he would become if he chose each option. Providing aggressive care as requested is legal. However, he would not want the public or his colleagues to know that he failed to advocate for his patient's autonomy. He strongly feels that this action would cause Debbie harm and fears that he would be acting without integrity. Now, honoring Debbie's post against the wishes of her surrogate decision-maker is illegal, and therefore he would not want the public or his colleagues to know about this choice. He values compassion and doesn't want to ignore Becky's feelings or disrespect her values. The benefit of this option is that he believes it will best respect Debbie's wishes and will result in the least amount of harm to her. Meeting with Becky to discuss his concerns and goals of care for her mother is legal and would not cause Debbie any harm. He would be comfortable with the public and his colleagues' knowledge of this action. He believes that Becky wants to do the right thing by her mother and is just feeling too overwhelmed to do it alone. He hopes that this discussion will lead to reinstating of Debbie's DNR and thus proving least harmful. This is the only option that doesn't violate any of his values. Requesting a different provider because of discomfort with the situation, while legal and acceptable from a public and colleague standpoint, would not do Debbie any good. She may still receive aggressive measures. Further, Pete has cared for Debbie for the past 10 years and is best suited to care for her. This option would demonstrate an overall lack of compassion, integrity, and courage. Based on the previous tests, the choice seems clear. Pete will have an empathetic and candid discussion with Becky to express his concerns and determine goals of care. After determining the best course of action, Pete must be motivated to follow through with his choices. By nature, he's risk-averse. He has difficulty having these delicate conversations with families. But over the years, he's developed moral potency, which consists of moral ownership, moral courage, and moral efficacy. For his patient, he won't let his fears and doubts stop him from acting ethically. Pete has shown moral intent, moral judgment, and is now morally motivated. Let's see how he translates that motivation into action. He considers how to best approach this conversation. He wants to show Becky empathy, but also needs to ensure that her decisions are consistent with her mother's values, and if not, he needs to help her see that bias and support her in coming to an ethical solution. To prepare himself, he considers arguments and rationalizations that Becky may give for her decision. He scripts himself for the conversation, including ways to handle her rationalizations. He's going to show empathy and compassion while reminding Becky of her responsibilities as a decision maker. He will be prepared with resources that he feels may support Becky in honoring her mother's wishes. He considers who to include in the conversation, where to have the conversation, and what communication style to use. Because Debbie is so confused, he feels a private location away from the bedside would be best. He will include a palliative care nurse who can provide Becky with resources. He must remember not to become judgmental when talking with Becky. Pete now feels prepared for his meeting with Becky. Let's see how he does.
It's good to see you again. Sorry it's under these circumstances. This is Beth. She's our palliative care nurse practitioner.
I think you met with one of my colleagues back in June. You're with your mom.
So, can you tell me what happened this morning?
When Mom woke up this morning, she just wasn't acting right, and she was sleepy and started limping on her right side, and then she just fell and she hit her head, and there was blood everywhere. So I called 911.
That must have been very hard for you to see. It sounds like the ER doctor and the neurologist talked about placing some drains. Can you tell me how you feel about that?
I don't know. I'm not ready to lose my mom. My dad just died, and it's so unfair. I don't know what I'll do without her. And Mom always said that she didn't want to die in a hospital, and that's why I told the ER doctor just to do everything to keep her alive, and that's why I signed the consent for the neurosurgeon to place the drains.
You're right. None of this is fair, and you've been put in an incredibly difficult situation. Back in June, your mom and I discussed some goals of her care, and she decided she didn't want any aggressive measures taken. Do you think anything's changed since then?
Not really. I don't know what to do.
You know your mother better than anyone else in this world. If she could get out of the bed right now, what do you think she would tell you to do?
She would say, just get her the hell out of here. She'd want to go home.
It sounds to me like you want to support your mom's wishes, but you're pretty overwhelmed with your situation. Is that accurate?
It just seems impossible to get her home at this point.
So I know it seems impossible, but it's actually more possible than you might think. If we get set up with hospice, hospice can provide you with medical equipment, medications. You'll have 24-hour hotline you can call to get a hold of a nurse, an aide. So a ton of support for you to get your mom home. And in addition to that, you're going through an impossible time right now, and it sounds like you're having a hard time. And there's support groups that, with other family members going through the same thing, you guys can help each other through the process. And after your mom does die, those resources are still available to you.
If she had the drains placed, would she get better?
I really can't say. She might show some improvement, but the problem is with her underlying tumor, it's causing cerebral spinal fluid to collect in her brain, and it's causing her brain to swell. And at some point, she's going to need an extremely invasive surgery, and we're going to have to place a shunt, and it's going to have to handle that fluid. And I don't know, to you, does that sound like something she would want?
Definitely not. Like, she wouldn't want any of this. Can you tell me how I can get her home and about hospice?
I would be happy to help you navigate through this process.
Mm-hmm.
So, just to clarify, it sounds like you want us to focus on your mother's comfort and avoid these aggressive measures, including the drain, and honor your mother's pulse, indicating not to resuscitate.
Yeah, I think that's what Mom would want.
Okay. I'm going to notify the neurosurgery team, and we're going to write some orders so the nurses here can focus on keeping your mother comfortable. And Beth and the hospice team will work on getting Debbie home. And if you need anything at all, let the nurses know they can contact me at any time.
Becky signed consent for hospice. She was able to get Debbie home that afternoon. Debbie had a peaceful death the next evening, in her own bed with her daughter and her cat at her bedside, just like she wanted. Becky is taking advantage of the hospice support groups. She's glad she was able to give her mother the death she deserved, and is grateful to Pete and the hospice staff who supported her through the process. Through his ethical action, Pete showed moral character. He demonstrated courage, wisdom, prudence, humility, integrity, and compassion. These virtues help Pete work through moral choices, work around barriers, and demonstrate courage and strength to ensure that he acts ethically in all situations. After progressing through the four-component model, Russ would say that Pete has demonstrated moral maturity. Now, the seventh step of the belief model ought not be overlooked. Pete needs to evaluate the outcome of this dilemma. Did he make the best decisions possible? Was he influenced by ethical bias? Is there anything else that he could have done differently? Through deep reflection, Pete hopes to become the most ethical provider that he can be. To determine if he has made the best choice possible, he reflects back to his nursing ethics course and the ethical theories used to guide decision making. While principalism is the most commonly used ethical theory in medical ethics, Pete always found that it failed to capture foundational nursing values. So he considers instead the 6 tenets of decision making. He thinks back to the potential solutions that he developed to respond to this dilemma and finds that the family meeting was the only choice that didn't violate at least one of the 6 tenets. So he is happy with his decision. He considers ethical biases that may have influenced his decision in this dilemma. He thinks he was probably overly confident about his knowledge of Debbie's wishes. He considers what he would have done if Becky had remained adamant about aggressive measures. He was affected by bounded ethicality, as practicing within the confines of the law would have prevented him from acting in a way that he knew to be ethical. Pete then considers what he would do differently in the future. He feels strongly that he should have started the conversation by acknowledging that Becky was a loving daughter. He wonders if Becky had more concerns than were initially expressed, as he failed to specifically ask her about them. He also wonders if he included palliative care in the meeting because of his overconfidence in his understanding of Debbie's values and wishes. In the future, he thinks he will consult after clarifying goals of care with the family. Pete wants to become a more ethical provider. He hopes that in discussion board this week you will all help him to see the ethical dimensions that he missed. Were there any other biases that may have affected his choices? Pete is still getting used to these delicate conversations with families. He used the values mnemonic when talking with Becky. He valued her comments, acknowledged her emotions, listened, expressed his understanding of her situation and feelings, and elicited questions. What are some other good communication strategies that Pete could use in the future? Thank you for watching my presentation, and I look forward to our discussions this week.